So,
Yes.
you know, it take to mind that today I end up I was driving and then I realized that the place was kind of cloudy, looking cloudy. So I thought it was about to rain,
Hmm. Hmm.
overcast or something.
Oh,
But
okay.
but then I
Hmm.
learned about all of this smoke, you know.
Hmm. Yes.
And of course, as we
Hmm.
all do, we get information one way or the other. Yeah,
True. True.
have you heard anything about it? You want to tell us anything that you hear or anything you can confirm, allegedly spoken or written
Mhm.
anywhere?
Oh.
Well, I heard about it on the news last night.
Hmm.
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 It was a little um on the foggy side yesterday, but it wasn't as bad.
Hmm.
And and I came home. I was smelling smoke, but I thought, was okay. I thought something was burning somewhere around the place. It's any mind. And then
Hmm.
last night, I heard about the fire in Canada.
Mm.
And then later I heard about the fire in Jersey. So I said,
Yes. Uh-huh.
okay.
Hmm.
So I go, okay. And then this morning
Hmm.
there were, on the news, it was all about the fire from Canada that's affecting the air.
Hmm.
Wow. So
Okay.
I went to a luncheon meeting today, and
Mhm.
before I left, I was like smelling smoke, and I said, okay, that's not good. And
Hmm.
everybody started talking about it. When I
Mhm.
was outside, it was like it
Mhm.
was so smogged,
Wow.
and the smoke was so bad, you
So
know.
it's,
But it was wearing my
so you have
Oh.
to draw for your mask again, right?
yeah. I didn't have my
Yeah.
I sweater on, so I put it over my nose until my car came, and then because I have mask in my car, so that's when I put on one when I left my car again.
Mm.
Yeah, that's something else.
Yeah. Hmm.
Well,
I heard it last night. I heard a little bit on the news, but I wasn't paying that much attention. And then um, I looked out this morning and I was about to go out to walk. I'm like, it looks like an overcast.
Mm-hmm.
And I say, is it going to rain? And then I saw it on the news. I started hearing people talking about the fire and, you
Mm-hmm.
know,
Mm-hmm.
so I went out for a little bit for
mhm.
maybe about 30 minutes, and I had my hat on, and I had my mask and my glasses on, and as soon as I came in the door, I just got rid of everything, and it just kind of reminded me, like with COVID, here we are again with the mask.
Right, right, right.
And people in the stores, I ran in the stores for a few minutes, and I saw people outside, and you could see the fear, like,
Mhm.
here we go again, here we go
Mm-hmm.
again with the masks, and they all had on masks. But it wasn't
Mm-hmm.
that many people out there, just people in the store, when things happen, they panic and they run in the store to buy everything. So
Right,
it's
right,
it's
right.
interesting. It's really interesting. Yeah. So
In a normal season, half of Canada's fire are started by lightning, but those
wow,
fires account for more. Can you see this on the board here?
it's very small. I have
It's
to.
fine.
Mhm.
I can't read
Uh-huh.
it.
Oh, okay,
Mm-mm.
okay, okay.
Let me see if I can
But
put
uh,
this on
but those
together.
fires account for more than 85% of wildfire
Yeah.
destruction. The other half are human caused. In Quebec, for example, fires were sparked by lightning, but officials in Alberta have said that the cause of fires there is currently unknown. So,
Mm.
you know, well, it's not the first time in Canada, right?
Mhm.
Fire
Mm-mm.
um,
Mm-hmm.
escalate to this level, yes?
Mm-mm.
Mm-hmm.
And
Right.
we have it going But okay, we go back to that in a moment. We can talk about it
Mhm.
just the same. You were making a
Okay.
point, Grace.
Mhm.
Mhm,
About the no, I was just saying the different, different reports I was watching, the
mhm.
reports about the poor air quality,
Yes.
and and they said it was extreme, it's a public health emergency, and that's scary just to hear that. you know
Mhm,
and the level is 400, and normal it's 100, so that's like 4 times the amount. So it's a concern, as being someone in the health profession. It's scary to know that it's
mhm,
affecting millions of people, and
mhm,
those with
mhm.
any health condition, or even if you're not, you need to just back in your mask or stay home. The best thing is to stay in with your windows closed. Keep everything closed.
Um, yeah,
It's sad, Okay. Huh?
And
this,
incidentally, both of you have worked with the health industry, so to speak. Yes.
yes,
Um,
Yeah.
and Judy is
Yes.
also
Oh,
currently
okay.
in the administrative part of
mhm,
the health
Okay.
industry. Yes.
yeah,
Um,
Yes. Oh.
indeed,
it-
indeed. So, what do you think?
Mm-hmm.
Um, I mean, even though you're not directly in the nurse area, but you are in the administrative part,
yes.
that means you have knowledge
Yeah.
about what your surrounding and what's going on.
Mhm.
Def-
What kind of reaction you expect at your place in terms of how you'd look at it in
well,
your
well, I wasn't there today because
mm-hmm.
when all this smog came in, but
Mm-hmm.
it was very concerning. I was at Rusa on the Bay. For
Yes,
me,
yes.
everybody was up in arms. They were like, "Oh,
Wow.
yeah,
Mhm.
not good," you know, and
Yes,
Mhm.
yes.
and I said to everyone, you need to wear a mask outside.
Mhm.
The,
Mhm.
the health,
Yes.
you know. Sorry. So because I said, if this is coming to Canada, the people that's in Canada, what's going on with them? Because we're not that close, and yet it
Mhm.
it affects us so
Mm-hmm.
badly, and
Yes, yes.
I called my daughter and I said to her, this reminds me when I started to come and visit this in the early 80s.
Oh.
Mm-hmm.
Very muggy, smog. The
Mhm.
smog, very smog.
Mm-hmm.
We never. I didn't see stars until for years. You couldn't
Mhm.
see in the night because it
Mhm.
was so smogged, and
Mhm.
the air wasn't great neither. But it cleared up after years. It took years before a star in the
Mhm.
sky and the air, was much clearer than then, which is,
Mhm.
you know, and
Mhm.
I was driving home and I said, let me call my mom just to make sure she stays in, and she
Mhm.
said the they have like the adult services where they go and perform, they get a meal or play bingo and stuff like that. And she said she went, and there was a lady that she's and she decided to walk outside, not mask, and she had to turn back in. She almost passed out.
Wow. That's today?
Mm-hmm.
Yeah, yeah,
Oh my goodness.
yeah.
Wow.
Wow.
And
Yes.
they're all elderly people.
Mhm.
Mm-hmm.
Mhm.
So mom said they had to take her back inside the building. She almost
Mhm.
on the road.
Mhm.
So
Mhm.
I said um she said she had her mask. I said, okay, but please don't go back inside for the rest of the evening. Stay in.
Mhm. Mhm.
And, and just try and stay healthy, because this is not good. It's not good for your
No,
lungs. Just not good.
no. And yeah, and you see, like, and that's exactly what you're saying, and that's those are some of the people that you have to look at first, the elderly. The
Yes.
elderly, those are some of the who should be, I mean, we all should be careful, we all should be wearing our masks or staying as much as we can, but
Mhm.
these are the target groups, that like the elderly, those, like, most of them have the COPD, and they have like as immunocompromised, meaning their immune system is compromised. So they need to we really need to look at them, and like families should really check on each other right about this, this time. It's a chance. So if you haven't called a loved one, to just call. Like, I made some calls today to some of the people that I know, like some of the kids that have asthma, and I'm like, don't let them come out if they don't have to. And
Yeah.
I was on one of the lists that I wasn't on. I didn't get the memo about staying in today, but I had already gotten the information, and I shared it with Michael, but you already knew about it, right?
Yes, indeed.
Yeah. But those are like asthmatics, and like a lot of kids now, like even some of the inner city now, it's a high rate of asthma, and they would be affected. So um, we have to really kind of warn, this, just call someone and have them to call someone else just to check on them right now.
Yeah, it's a human concern.
Yes, it is. Yeah. And
Mm,
so the air quality is so bad. It's in
right.
they're saying it's in 18 states. Can you imagine 18 states is affected all the way even to the Carolinas? I'm like, wow, we're so connected. It's not as big as we think. The United States. We think it's so vast, and so
But it's strange because since
mm,
last week,
so
last
mm,
week Friday, I was going to work, and
mhm.
the moon was so red.
Oh
I said,
wow.
it looking so red.
Mm-hmm.
Okay.
Yeah. Mm.
So how long we're predicting this? What, Mrs. Weather Lady? Ooh.
Oh my goodness. No, well, they're saying till tomorrow, but tomorrow night, like 11 something, but I think it's going to take a few days. Do you think, Judy? I think
I,
it's going to take a few days. What do you think?
I think it's going to be a few days
Yeah.
also, because the weather, they're confused. These weather people, you
Yeah.
can't get by what they're saying either. They're just
Uh-huh. Uh-huh.
predicting stuff. But I can't see this clear up um in
It
one
could
day.
be it could be a week, right? Because
So
yes. Yeah,
it will take days.
yeah. And all the pollutants in the atmosphere,
Yes.
and you have the carbon dioxide, and all of that, all of the things in the air. And it's
So
been very windy today.
so
Yeah.
with the Canadian
Mm-hmm,
fire and the smoke
mm-hmm,
and the
mm-hmm,
atmosphere,
mm-hmm,
everything up in the
mm-hmm,
air, right? So, but
mm-hmm.
then in Jersey, New Jersey, and you are in New Jersey, right, Grace?
Yes, I'm in New
How
Jersey.
how is it
Uh-huh.
over there? Because with the one from Canada, plus you have your own fire over there. How-
Okay. No, but
I mean,
what
one not enough.
happened?
You have two.
Yeah, no, we have two. The one in New
Wow.
Jersey. What
Hmm.
happened? It's
Hmm.
more South Jersey, south of me. I'm more north.
Hmm.
And
So it's going
it's
back like
what
to Trenton, is
it's
it?
yeah. It's more Ocean County is more south,
Okay.
closer to
Okay.
Atlantic City in that region. Yeah, I think that's a region. I'm not sure that
Hmm.
area, but it's Ocean County. And so you have they said it's 70% contained now.
Mm-hmm.
So yeah, but that's it, but you think of those firemen out there, and the wind was pretty rough today.
Mm-hmm.
It was pretty rough. So 70%, that's good, but that's still it's still not that much. We want to hear 100% contained.
Yeah.
So when did that fire
Mhm.
start in New Jersey?
I don't know. I found out about it today.
I'm
Um,
saying something
uh,
here. Jackson
mhm.
Township wildfire, New
Yeah,
Jersey
Jackson
Forest
Township. Yeah.
Fire Service says 82-acre fire.
82. Mm-hmm,
They
mm-hmm.
say 100% contained
Oh,
up
it's
to the last
100%.
3 hours.
Okay,
So they're
okay, because
saying
3 hours
now
ago.
it's
Mm-hmm. Yeah.
Yeah. I'm curious to know what started the fire in Canada.
Yeah. Wow. Hmm. Wow. That's
you know,
yeah.
there's always something said about anything, no matter what.
Yeah, yeah. You wonder, people the weather is breaking now, so people are
Mhm.
out camping.
Oh,
And those campground
true.
fires, because sometimes that's some of the ways the fire starts with, they leave the air out all the way. And
I
then
think
I
we're
don't know if it's
definitely
been dry. Hmm?
coming back to this podium to talk about this fire because we're gonna get more information and update
Yes. Uh-huh.
our thoughts and um
Hmm.
but a public service common sense. Why would you advise people in general? Because we have to talk about for the people too. What's your
About
information
as far as hmm?
pertaining to a situation like this, the smoke and all of that stuff? Why would you um advise anyone?
Well,
Not from a medical, but from a common sense point of view. To wear your mask and things like that. Yes, is it?
Yes, I would
Is the mask
with
that effective, really?
I would think with the situation at hand,
Mhm.
Mhm, mhm,
um, I think staying away from alcohol right now, um,
mhm,
stay away from cigarettes,
mhm,
um,
mhm, mhm,
drink water, to flush your
mhm,
lungs,
mhm, mhm,
get healthy, wear your mask, and
Mhm.
stay indoors as much as possible. You know,
Mhm.
mhm,
Mhm.
now it's not the time to go out and exercise because when you do exercise, your
mhm,
your lungs is expand, so
Mhm.
mhm,
more air.
And I
So
like to do
take
outdoor exercise.
all,
mhm,
so
mhm. Mhm.
so you
Yeah.
You can
Mhm.
run from the smoke.
Mhm.
take all these impurities
Yes.
because it's not good. Your lung is the filter for your body. I'm
Yeah.
Grace, I'm talking like a nurse, right?
Good point. Good point. Good
Mhm,
point. Well, as I said, common sense,
mhm.
information is good. What do you have to say about
Mhm.
Minister Grace?
Yes. Okay. What to do? Can you just repeat the question? I had
Your
an
common sense
interrupt.
advice for the general public.
Well, I would say, just to listen to what they're saying, on the news, as
Mhm.
far as, staying indoors as much as you can.
Mhm.
I would also agree, like, liquids. If you
Mhm.
have to go outside, which some people still do, wear your mask.
Mhm.
Um, and I would also, just stay away from what I told you before, just check on someone, just make a phone call to check on someone
There
else.
you
And,
go.
maybe a neighbor, or, I have
Yes.
neighbors that have twin babies. So I call them, and I call another young lady to say, your daughter has asthma, make sure she stays in. And so that was well received. So basically is that just listen to, kind of follow the lead of, I know sometimes they're off the weather and all of that.
Yeah.
Just kind of function and just use wisdom, and just
And for
if you
now,
don't
what
have
you
to
see is
go
what
out.
you see.
Mhm.
Mhm. For
What you
now, what you
say?
see is what you see, I guess.
It
So
is, you know,
I just see
it's a
it as it
little,
is.
yeah,
Mhm,
it's a little scary because we just got out of
mhm,
COVID and then here we're in the mass, and then you really don't know how effective these masks are because,
mhm,
you know, you're
mhm.
talking about smoke, you know, so you're talking about smoke, so you're wearing the N95, but it's not how effective is it when you know go outside. If somebody's breathing is already compromised, then it's, you know, it's even harder, you know, it's harder for them to breathe with the mask. So just say stay indoors if, as much as you can, and just
Um,
check on each other. Yeah, go ahead.
yeah, yes. This evening, talking about those to wear the N95. It's more effective than the others.
Then the others, yeah. It
Mm-hmm.
is, but you know, we're just like it is more effective. That's what they're suggesting, that, you know, that we're to wear, you know, and they're giving them out, I think, in places in New York and some of the areas, like, you know, I think here in New Jersey too. I saw the governor of New Jersey, and he just said, just stay informed, you know, wear your mask. And he always has a little buzzword that he's saying, you know.
Mm-hmm.
Indeed,
Basically, they're
indeed.
all saying the same thing. New York mayor, and then the one from Canada. They were all saying about the same thing because they really don't know what to do. You know, they have to say something, you know, to, I guess it appeases, you know, the people,
Right.
but really, you know, you have your own thinking. Oh my God, here we go again. And the
Yeah.
And
go ahead.
so now that this happened,
Mm-hmm,
COVID passed, the smoke come,
mm-hmm,
thick,
mm-hmm,
um, dense smoke.
mm-hmm.
But what do you think about the after effect? Do you think it's gonna be a mild one, or you think just it's gonna be harmful? You think it's gonna be just disappear? It, I mean, it must have
Mm-hmm.
some impact on even building human, you know, lungs or maybe
Well,
even crevices or so. I mean, what do you think? It's just gonna just vanish? Nothing happened?
no,
I don't know.
no. Well, I
We don't want to
one of
think
the
too deep into it, but of course, what do you think?
Yeah, well, you know, it's going to, because already they're saying it's affecting millions of people, over 100 million people, and so you have those people that already have the problem, you know, with respiratory, heart, lung cancer, all
Hmm.
those patients. So they're going to have to be monitored more closely because somewhere it's going to be affected. The ambulance, I think in Patterson, they said all the ambulance, there was so many emergencies already. So I
Hmm.
know
Hmm.
the emergency rooms are going to be full. Maybe at your place, Judy, the emergency rooms are going to be, you know, it's impacting
Yes,
all of
yes.
that.
We
And you
definitely
know,
have to
so
monitor all these too.
you have to,
Hmm.
yeah, you have all, you
Yeah.
know, when we call, if you call 911, usually the our fire department is like a few, you know, like a few blocks. They come right away. The fire department comes first. So,
Mm.
you know, I feel for them that, you know, these guys have to be out there battling that. So it's it's not just going to go away because it's going to be some effect. There's some people's lungs, you know, like I said, they're already compromising their, you know, their health and their conditions. So we're going to see some effect from this, even though
Yeah,
they're saying that.
I totally agree with,
Yeah.
it affect quite a few people, a
Hmm.
lot, I should say, because
Hmm.
of health conditions, So
Hmm.
the it's going to be something else.
Hmm. Hmm. Yes. Yeah. Because, you
Mm.
know, you're talking about smoke, you know, yeah, you know, the cough. You're gonna have people that's cough, you know, with coughs and some lingering effect. It's gonna be. I can't say yet, but I know it's gonna be some.
Yeah, when I was on my way home this evening with all
Mm-hmm,
that smog,
mm-hmm,
it was really intense. And I couldn't believe it. I saw this driver coming in the opposite direction, right? From the stoplight. He had
mm-hmm,
his window down, the driver
mm-hmm,
had his
mm-hmm,
window down. he had his hand out with a cigarette
Oh, that's the other thing.
in the midst of everything. I said, my gosh, such a slave to the cigarette. He's not seeing what's going on. He's not smelling all that fumes. He's still smoking.
Again, I
And then,
guess it's just smoke, right? To him, it's just smoke.
yeah,
It's just, yeah, it's yeah. I guess they have it's old habits, and that's all. That's one of the component already of of a fire is the heat, and so it which is a cigarette.
yes,
So it's and then you have the oxygen. The other thing is the oxygen in the air. So
yes.
you need that. You need the fuel, the heat, and the oxygen. So already he has both there.
I
So
couldn't believe
yeah,
it. Mm-hmm.
yeah, yeah. So it's a habit, It's old habits. So and sometimes people are afraid too. So that's their next go-to. It's
Mm-hmm.
like it's either a cigarette or it's something else. So
Yeah,
yeah, so yeah, that's all. Mm-mm-mm. But it's interesting at this time, at the last month, school is about to let out.
yes.
And one of the things now, my concern is the children because they were out of school so many school days already. And so now they want to do indoor. Seem like they want to put the kids back into indoor learning again,
Oh, is that in
put
Jersey?
some like the colleges now, they're saying they want them to, yet a lot of the classes they want them to do, what is it, homebound, like how they were doing before,
Mm-hmm.
where nobody's going to class.
Home
I
studies.
hmm?
Home studies.
Yes, home study.
Mm.
um Even like all the activities were canceled. I have a niece that's a coach, and she called me and she was really concerned, because it was pretty bad outside. It was at 2 o'clock. They said, it was going to be bad at 2, and at 2 o'clock it looked like it was like nighttime because that's
Yeah.
how dark it was outside. So she was able to cancel. She's a um uh, field and track coach, so she was able to
Okay.
cancel all of that. All activities were canceled.
Mm-hmm. Yes,
Yeah,
because
so
my finished at 2:30 and it was
mhm.
really dark, you know. It,
It was dark. It was
mm,
dark outside.
mm-hmm.
Yeah, so we just have to see, but I'm just still concerned for for those people that's because of the smoke, the aftermath. What's going to
Yes.
happen? People with some that didn't have problems before. I pray that they're not with new problem, new respiratory thing, all of that.
Mm-hmm.
And so, and it's not a matter of even how healthy you are. It's just, because once you're exposed, to smoke, it's you're exposed, your lungs, and we need our lungs. So, and this, it not only it can get in your bloodstream, the smoke, and you have all the pollutants that's in the air, like you have the carbon, carbon dioxide, all the other things that we try to have monitors in our houses to prevent, to alarm us. But then when it's right in the ear that we're breathing, I'm concerned, I'm
I
concerned about that.
mm-hmm. Very
Yeah.
much so.
And so wow, that's a lot. It's a lot of people. So,
Yeah.
and it's truly a public health emergency. Seen anything
Mm.
like this? Huh?
Yeah,
Hmm?
yeah. It's
Yeah.
I haven't seen anything like this.
Yeah.
Um,
So.
on the early
Mhm.
80s, it was bad too, but
Mhm.
this is really
Mhm.
something.
Mhm. Mhm. Yeah. So we just have to just hope for the best.
Yes.
You know, hope for the best because this is serious.
It is really serious.
Mhm, mhm. Yes.
And it doesn't just affect human beings, it affects animals too.
Oh yes, yeah. There was a report today. They were talking about the animals.
Yeah.
You know how they're affected, and you know if you're walking them outside, they
Mm-hmm.
it affects and a lot of the animals now. They're having problems, just like human beings.
Exactly.
Yeah, they're having problems.
Yeah.
Yeah. Oh, that is something. You can't even walk your pet outside.
Yes.
Yeah, we'll definitely
Yeah.
will see what's going on, and we do
Mm-hmm,
follow up on
mm-hmm.
it, of
Yes.
course.
Uh-huh. Mm-hmm, mm-hmm.
Let's pray
Interesting,
and
interesting. And so I think we should pray too. So
Mm-hmm.
we pray.
we pray for
Mm-hmm.
everything. We gotta have prayer with this one too.
Yes, we do. Uh-huh.
Yeah.
In the
Yes.
mighty name of Jesus. So I'm telling you,
Mm-hmm.
but I mean, it's sad, but we'll see. I hope the best in everything that is happening right now.
Mm-hmm.
Best result will come out of this still, out of
Yeah.
something bad.
Yes.
I don't know how to put it,
Mm-hmm.
but let's see what happens. Eh?
Yes.
Yes. Yes.
Mm.